Dr. Nick Delgado here with Sonia Bansal.
Hi, Dr. Nick. How are you?
I know you're a board-certified dermatologist and you're the co-author of Acne Be Gone for Good. This is an important podcast for us because I think people around the world are concerned about the ever-growing incidence of not just chronic diseases, but the obvious signs of chronic diseases. And what's more obvious than looking at a person's skin? And when you see their skin, and if it's broken out with pimples, blackheads, acne, I travel all over the world and some countries seem to have a bigger problem. I've noticed the Philippines in particular and some other areas. And then I've also noticed in some places I've traveled where their skin's immaculate and beautiful. So what's going on? What is the cause of this acne? And we'll start with that. What is the cause?
You know, Dr. Nick, I think just as you know, there's a multitude of different reasons that people get acne, and some of this is covered in our book. The four main factors that we know medically absolutely cause acne are imbalances in the hormone level. Quite a large percentage of this is still unknown, and I think that's where you play a big role in letting us know what exactly is going on with hormonal imbalances. Number two, a lot of oil production. So the oil gland is overproducing, working overtime, producing so much oil on the skin, especially the T-zone, and that's probably the most common clinical issue that I have is I'm just so oily T-zone, and that causes a lot of acne in those areas. That also breeds pores that get clogged up. So nothing can get in, nothing can get out. It can't breathe. So the pores are all being clogged up all over the face, the chest, even the back. After that comes bacteria. It's a great environment for bacteria to grow under the skin. And then that breeds the final, which is inflammation. Inflammation comes in to try to eat up these bacteria that don't belong there and really clean things up. So if you can imagine, that's a lot going on under just one little pimple. Imagine it going on all over the face, chest, and back.
Exactly. And, you know, I think that there's been an ongoing dogma or belief, particularly in the dermatological field, that maybe diet doesn't play much of a role, but they're starting to open their mind now, starting to realize, and there are published studies now that are finally confirming that the diet, the foods that you eat, particularly influence insulin, a very, very important hormone. They influence testosterone. They influence the production of estrogen that might have an effect on what's called sex hormone binding globulin, and that affects how much free-floating hormones are in the body. We know that we're exposed to toxins in the environment. There's so many more chemicals now than maybe 100 years ago. So we're at a very important crossroads where people need to be educated, but more importantly, there are solutions, aren't there?
Absolutely, and you touched on a really important point. The glycemic index, or those insulin spikes that are happening in the body, is one of the causes of these hormonal imbalances that breed acne. So if you ask a person, you know, is there something that really breaks you out? A lot of times they don't know. Certainly we thought about maybe dairy and fried foods and the things that people associate with acne, but there was really nothing in our literature to prove that association existed until there was a journal, I believe it was out of Australia, where they looked at glycemic index and they looked at insulin levels and they found that insulin spikes were not good for the skin. And what caused those insulin spikes? Well, it's all the stuff that's bad for us, the stuff that we shouldn't be eating anyway, the dairy and the greasy foods and the fattening foods and the sugars. All of that really went into those spikes that caused breakouts. So what a really good thing for, you know, those acne sufferers out there, if they're not quite sure if diet plays a role, you know, I tell them go ahead and keep a journal every day. You log in the foods that you're eating every day, and over maybe the next 6 months, you might start finding that there might be trends. So I'll usually tell a patient, look, we know that the healthier foods are always going to be better for your skin, but keep a diary, you know, keep a log of what really is causing those exacerbated acne flare-ups. Because if you find there's that association, of course, naturally, you can take that out of your diet.
Well, Dr. Sonia, I know there's this growing belief, particularly with the resurgence of an old throwback to the Atkins diet, the keto diet. These people are basically blaming everything on sugar. And I get it, sugar's not good for you, it's processed. But why don't they understand that equally bad is the fact that these oils are processed. They come from whole natural foods. They've removed the fiber. They remove most of the vitamins and minerals, particularly the phytochemicals and enzymes that protect and stabilize blood sugar levels. Dr. David Jenkins, in his landmark work regarding glycemic index, talked about the fact that fresh fruit, 10, 20 servings of fruit a day, has, because of its polyphenols, a very special chemical inherent within whole fruit. and in olives and other whole foods, that it basically stabilizes insulin. So now we're coming in and looking at this closely, and we want our audience to know that oftentimes it's separated oils, excess fats, and meats. These oils and fats, they tend to cause the insulin to not be sensitive any longer, meaning insulin's main job as a hormone is to push glucose into the cells, fatty acids, amino acids, and really much like insulin-like growth factor, it's a subgroup that is insulin itself. To make it real simple, it just ushers in the right nutrients into cells to be burned for calories to give you energy and to function, to live. But if the insulin is desensitized, meaning there's something that's altered its ability to usher the nutrients into the cells, then we have metabolic syndrome. We have the potential for developing PCOS, polycystic ovarian syndrome. So there's a whole host of things going on. And I know people say, but I know when I eat candy, things get worse. But what kind of candy? Is it Skittles, which is just sugar? Or is it like milk chocolate Hershey, where it's fat and sugar? I would lend to say that certainly the sugar is not good, but when you add the fat, that compounding effect, you've got the worst of both worlds.
Yes, absolutely. And now we see a couple of different demographics of a patient population that's entering not only just the teenagers, because with teenage acne, the standard is they usually grow out of it. But now it's this whole adult onset acne, or this hormonal acne issue that we're facing, which is a lot more common than it was a couple of decades ago. So there is definitely something else going on, and that is very much environmental, I do believe, where you've got all your bad estrogens and your hormones and your stress. And I mean, when you compare it to just the simple diet that even when I go back to India, when I look at the diet that they have, it's all fresh, it's organic, it's the cows that are raised raised in the right way. They're so everything that we have there is very fresh. And for them, they actually don't even eat the same food as the same day. So they're considering food old after an hour to 2 hours. They will actually give it away to someone out there, the homeless population, because they believe that strongly that fresh food and organic food is that important. And you'll see this minimization of skin problems, of the skin disorders, especially acne.